Good afternoon, everyone. Thank you for joining. My name is Michael Pepe, and I am the Director of Sales Engineering here at Synzi. Appreciate everyone joining this afternoon at the end of the week. Today, we're going to cover how to manage patients with chronic conditions using Synzi and using telehealth. And we're really going to cover a lot more than just telehealth and virtual visits using the platform. So if anyone has any questions, please feel free to chat them in the box. We'll stop at the end to take any questions. And if you want more information or a deeper dive into any of the platform that you see today, please reach out to us via email or on our website. Or if you're a current client, please reach out to your implementation team or account manager. So like I mentioned, today we're going to cover a lot more than just virtual visits. We're really going to cover how the platform is comprehensive, how our most successful clients are using the platform to manage chronic conditions with a variety of communication modalities. We're going to take a deeper dive into condition-specific messaging, so some of our educational programs, as well as a pretty hot topic lately, which is remote patient monitoring, to manage patients in real time, and the approach that we took as Synzi to manage those patients and monitor those patients in between visits. And then as well as another powerful tool, which is our assessments. So let me just set the stage and the reason of kind of what we've been seeing in the field over the past year, the past couple years, and especially in the past 6 to 8 months, really in the post-COVID and during the COVID era. So really what we're seeing is telephone engagement just keeps continuing to fall. So if you think about, in your own personal life, receiving unknown numbers that you don't recognize, those calls are surging. We see that across healthcare, across agencies too. Patients are answering those at a lower rate than ever. And really the days of thinking of your patient populations of not having any sort of smart technology, whether it's a smart device like a tablet, like a smartphone, those days are really getting behind us, especially as the baby boomer population continues to age. We're seeing that, a lot more people within the age range, and we deal with a pretty complex patient population, are either having access through a family member or their own device. So really what we've seen, especially over the past year, is, majority of people, whether 50 plus, 60 plus, 65 plus, even in the 70 age range, do have that smart device technology. So really what we've seen post April 2020 is a real adoption into virtual care. So really 28% of consumers we found have had a virtual visit in the past few months. Majority of them were satisfied with the results of them. There's been a big increase as well too. Not only on the post-acute side, but even the acute care and across every vertical we've seen. And then really leading us into the next generation of technology, which is wearables. And really the direction that we're taking the platform to become a comprehensive vehicle to manage chronic conditions. So what we're finding is a lot of adults are in possession purchasing some sort of fitness device or a Bluetooth type of device that can monitor vital signs. And that's where we're going to really cover in our remote patient monitoring and really explain to you the approach that we did take and why we did take that approach. And really, people still want to speak to their own clinicians. That's what we really found over the past couple of years with the platform is people still want to, speak to someone in their local area, speak to someone that they're familiar with, as opposed to speaking to someone based halfway across the country, a physician that they're not familiar with. All right, so where does that lead us into everything? Where are the results? And this is what I'm going to sprinkle in as we're going through the platform of some of the results and some of the most common use cases and the successful use cases of what we've seen across the platform. But the majority of text messages, as opposed to a phone call, a landline phone call. Majority of text messages are read within the first 10 minutes. You're able to send richer content to patients. So whether that's videos or website links, different things to improve their education and their knowledge on a specific condition. It's using all these different communication modalities to improve the care of patients and reduce rehospitalization. And we've really found by doing this, you're keeping the patients engaged. We have a client down here in Florida that was using our patient program management tool, which was sending out education and text message and in-app messages to patients, depending upon their chronic condition. So whether it was COPD, CHF, or diabetes, took surveys at the end of each one of those campaigns. Found out people more than 50% can recall a specific message that they received or some of the education. So a lot of these folks are engaging on these different modalities. All right, so really why Synzi, and this is what we're going to get into in the platform in a couple minutes, but being able to connect with your patients, their family members, and staff members all on the same platform. This webinar today, we're not going to be focusing on staff to staff communication within agencies. We do provide that all on one platform, but the focus today, is really going to be staff, clinician to patient communication, as well as their family members. They don't want random phone calls anymore. They want to be able to connect across pieces of technology that they're already comfortable on, and to make it convenient for them. So I'm going to show you a couple different methods and way some of our clients are using a couple different methods of the communication modalities on our platform to make it convenient for their patients, and then gathering that data. And then really what do you do with all that data is gather it and then able to analyze it within our Synzi enterprise admin. And that's where a lot of our reporting functionality is located, being able to aggregate that data and make different decisions on how you're going to manage your patients and deliver better care to them. So before we dive into the platform, just for any newer folks that are on the call, because we do have a mixed audience on the webinar today, Synzi is an all-in-one virtual care communication platform. We're device agnostic. We run across any platform, whether that's a Android phone, tablet, Apple. We operate off of web browsers as well too. And what we're really going to focus on today on the left-hand side is really consolidating all of these different modalities of communication, whether it's a virtual visit, text, email, secure messaging, assessments, and then remote patient monitoring, how to use them all at the same time to monitor patients in between visits and better engage them. Really our most successful clients, and we're going to start with a case study that's going to lead us into the platform, are able to use all the different communication modalities within our platform to manage the patient. So not just one or two. One or two is effective if you are engaging your patients by different care pathways, by a patient program, or by a video call. But harnessing all the different pieces of communication within the system really augments the care. A lot of our clients start out with getting comfortable on one aspect of the system, whether it's just virtual visits or communicating with patients by text or email, because to a lot of agencies, this is still new to them. But we quickly see that as agencies get more comfortable with the different communication modalities within the system, they're quickly branching out and using the majority of functionality within the system. So we're going to take those different communication aspects. I'm going to show you how to communicate with your patients, how to bring in a family member as well too, any outside physicians that you might be working with that are not within your agency directly, and how to communicate with all those folks simultaneously. All right, so just a little bit about our condition management portion of the platform. We're going to be using a use case, whether a patient has CHF or COPD, just for example, one of our more common ones, and show you what our patient program management looks like. This is a this is a very common area for a lot of our clients to start with. And we have a content library that we've sourced the best content from National Institute of Health, American Heart Association, or you have the ability to build your own content. So we have straight out of the box content if you're new to the arena and just need to get started, or you can absolutely build your own. And these are really a series of scheduled, automated text and emails that go directly to the patient. So really the foundation, the pillar for establishing communication with the patient to send out education. And like I mentioned, it could be a website, could be a video, or it could just be some simple education, like reducing your sodium intake or medication reminders. And then we'll explore the virtual visit area and some of the secure messaging area. And the platform is high trust certified and PHI compliant. So you'll see with my communication with patients, you're able to have those PHI sensitive conversations on the platform, share pictures, share PDF documents as well too, and all directly do that within the application. All right, and then to highlight, we're gonna focus on remote patient monitoring. So we took a completely different approach than a lot of other vendors that you might see out in the marketplace. We saw the future of patients really adopting this technology. So we don't have any proprietary hardware. We don't have any proprietary devices. Patients, agencies are able to purchase a Bluetooth enabled device. So whether it's a Bluetooth scale, a thermometer, a pulse ox, and we'll show you some of the vital signs that we did start with. They're able to pair it directly through the application, and you're able to send reminders to the patient throughout the day, monitor those vital signs in between visits, and then get real-time alerts if someone drops below a certain threshold, as well as some of the reporting. So again, we've seen this, in a variety of different ways being used. Want to take you through how you're able to, to manage these patients using these different devices. All right, and then just lastly is our assessments. So this is another powerful tool besides the Bluetooth enabled devices, being able to create and customize your own assessments. I'll take you through a COPD and a CHF patient. These could be set up to go out recurring. So if you're looking to gather data on every weekday or all 7 days of the week, I'll walk you through an assessment that's already created for a patient. This is pretty powerful on what clients use in between those home visits, because you're able to gather data. And again, you're able to get real-time alerts as well too. So, if someone responds a specific way, you as a part of their care team, anyone at the agency, a part of their care team, can get a real-time alert to their smartphone, to their tablet, to their computer, and then take action on that directly, as well as running reports as well too. All right, so really the case study that we're going to use today will be, a patient with COPD and or CHF, right? So, as you all know, very high rate of readmission. I think it's about 25% within the first 30 days of patients with CHF readmit to the hospital. So this, for a lot of our clients, is a big starter point managing this patient population. One of our clients that this case study came from, they saw a very low adoption rate and a high absentee rate to engage with the agency, right? So they were looking to really improve outcomes, cost saving, as well as reduce readmissions. So this specific client actually just used two portions of our platform. They used our patient program management, which we're going to walk through, which is the text and email and in-app delivery of education. And those can include different diet guidances and exercise guidance. And then they also used our virtual care portion of the platform. Okay, so explaining, different techniques, tips for exercise, or any questions on their medications through the virtual visit. But I'm going to layer in a little bit more today with that. And that what some of our clients are using now is the assessment tool and the remote patient monitoring to drive down readmissions even further and improve these results. So as you can see, just this initial case study of this agency that had about 3,000 average daily census, they were able to improve their engagement rate or decrease the absentee rate by 25% and reduce the readmission rate by 15%. So about an average of 175,000 cost savings in a month. Okay, so just one case study, but that's really what we're going to focus on today is a patient with CHF and COPD. So let me just go ahead. I'm going to minimize my screen. I appreciate everyone's patience through the slide deck and really want to focus within the Synzi platform itself right now. So like I mentioned, comprehensive communications platform, able to communicate with patients, family members, and staff all on one platform. So we're not going to focus on the staff communication aspect today. We're going to hop right directly over to our patient roster. So before I begin and explain all the different communication modalities that we use to manage patients with chronic conditions, we have the ability as well to, if you're looking to do a simple video visit with a patient or maybe send them out one of those assessments that I just mentioned, patient doesn't need to download an application for that. I'm going to take you through the Synzi Care Connect application today, which is our patient-facing application. But the patient, if you're looking to do a virtual visit or the assessment, you could simply send them a text or email, depending upon their preference. You can send it to them through both channels if they do want that. They can click on a link and be connected to a care team member via video as well too, and take an assessment via the web page as well. So we're not going to focus too much on that today, but just want to let all the folks that are newer to the platform know that we have that ability as well too. So don't want you to think that patients are required to download an application. So let's just take a walkthrough of a clinician, and this is our virtual care application. So I'm logged in as an RN right now, Dean Klein. You're going to be seeing myself shortly and how I communicate with this patient. But we'll use patient James Cook today, and we'll kind of walk through just the ease of use for your staff and how they're able to manage patients in general, not only just with chronic conditions, but to get a patient set up and get them configured onto the platform to receive a lot of these automated communications is very quick and easy for staff. So let's just take a walkthrough of the communication modalities first. And I just like to call these the on-demand communication modalities first before we talk about some of the automated tools. So we have a couple different options right on top of the patient profile. First is the secure messaging option. And this really encompasses anything, any sort of PHI sensitive conversation. So as you could see, a previous conversation that myself had with the patient James Cook, able to discuss anything about their condition. I'll show you once we get over to the patient facing application, able to snap a picture directly from their device. Let's just say this wasn't a Bluetooth enabled pulse ox, and I wanted to have the patient send me their latest readings. They could snap a picture and we can have that conversation directly on the secure message. We also do have a group messaging option. So if you do collaborate on any patients within your agency and you want to go ahead and add another nurse or maybe a medical director into the secure message conversation, you're able to do that. Okay, and we do have a simple text and email option. So think of your non-PHI communication. Also think of some of your folks that might not have a smart device. Maybe they're just on an older flip phone and you still want to communicate with those folks because they still get text messages. You're able to do that from the same platform. The great feedback that we have received, especially since COVID, is that first, everything is reportable out of the platform, whether it's text or emails, any of the virtual visits that took place within the platform, you'll get date and time stamps and any of the content that went out. And I'll briefly touch on that at the end. But second is really no personal phone numbers are ever shared out of the platform itself. All the text, the emails, virtual visits go directly out of the Synzi platform. So, knowing the past couple months, how regulations have really relaxed on the compliance side. And we've spoken with a lot of agencies that before they become clients, nurses will simply share their personal cell phone number with a patient. That's not done within the platform. Okay, so from here, I can simply type a text or email. I can choose from a pre-saved template. So again, we have a content library, or you're free to upload your own content as well. And I can simply send out maybe an appointment reminder. This could be an appointment reminder that for in-home visit, or maybe a visit with a physician that's coming up. And I can always customize this text or email further if I need to. And if my patient happens to speak another language besides English, let's just say I'm managing a patient population. We see this a lot in different chronic conditions. If you're managing a large CHF population that speaks Spanish, I can have these templates translated directly into their native language and saved within the platform. Okay, but really what we see clients use the on-demand messaging to is really reinforcing education, right? So, maybe I had a discussion with a patient at their home. This is a pretty common use case. Have a discussion at their home. Maybe I want to send some follow-up information. Maybe it's not one of those automated programs, but maybe I just want to send them a quick medication reminder because we discussed taking their medications. And if they are experiencing any of these symptoms, here's the number to call. I could quickly choose from the drop down and send it via text or email. All right. And then lastly, we have the virtual visit option. So this patient is already logged into the platform via the app. As a clinician, if I just want to make a quick outbound video visit to them, I could simply just click on the phone icon, and it's going to come directly in. And imagine you have not two of me, but the patient and the clinician. Okay, so engage directly on a virtual visit, and I can have up to 6 people on the platform. Okay, so I have the ability, if I want to bring in another staff member to the conversation, maybe I want to bring in Dr. Brown here, the medical director, into the conversation. But then I also have the ability to bring in a caregiver, and a caregiver could be a family member. So Meredith Daly is James Cook's daughter, or maybe it's an outside physician that wants to be involved in the care with the patient. All right, so let's go through some of the other communication modalities before we hop over to the patient application to show you their experience and really how many barriers that we removed for entry for patients. So the next section, pretty hot topic lately, is our remote patient monitoring. Okay, so we have the ability to monitor vitals for blood pressure, oxygen saturation, heart rate, temperature, weight, and then the newest addition has been glucose. So think about for your diabetes patients. Again, we connect via Bluetooth low energy enabled devices. We've found it's really the most cost-effective method for patients and agencies. So I'm going to walk you through when I'm over on the patient side. Think of me as a COPD patient. I picked up a $40 Bluetooth enabled pulse ox device off of Amazon, Target, Best Buy, Walmart. You can find most of these devices now in major retailers. I'll walk you through what that looks like from the patient perspective. We also do have integrations with Apple Health and Google Fit. So think about, as I mentioned earlier, as the wearable market does increase, on the Apple Health side, being able to connect heart rate as well as the newer watches taking oxygen levels and an EKG as well too. All right, so we're going to walk through this on the patient aspect. You'll see some of these yellow banners in here as well. I created some manual alerts for the patient. Okay, so like I mentioned, if someone drops below a certain minimum or exceeds a certain maximum threshold, you're able to get real-time alerts. All right, and then really what clients use to manage patients with chronic conditions. So we talked a little bit about, following up with the virtual visits. You have the real-time vital information received within the patient profile. So managing their oxygen levels, think about for a COPD patient, their heart rate. Then also coupling that with patient programs as well as assessments. So patient programs, again, are automated, pre-scheduled messages that go out via email or text message. So I'm going to go ahead and I'm going to enroll the patient in a COPD program so you can see what that looks like for the patient. And as you saw, when I enroll the patient in a program, I have a couple different options. I can enroll the patient now, or if it, maybe the program's for an annual flu shot reminder, maybe it's March and I want to remind them coming up in September, I can pick a custom date from here. But we're going to enroll the patient in the program beginning now. And again, these are pre-built programs that you can create or you can pull from our library that automatically go out to the patient and is delivered. Okay, and our assessment tool is our survey tool. So another way to monitor patients, gather data in between home visits. Think of it like a survey tool. There's yes, no questions that you can build out, multiple choice, text boxes. I'm going to go ahead, I'm going to enroll the patient in a CHF assessment just so you can get a good feel for the mix of questions as opposed to the COPD program. I want you to get to see the different variety within here. But again, I can get real-time alerts off of how a patient responds, as well as run some of those reports. And what we're seeing a lot of clients do is establish care teams for patients with chronic conditions. So majority of these patients are high-risk patients. You want to give them access to begin a virtual visit or secure message with a group of triage nurses at your organization or their individual care manager or a nurse. You have the ability to do that within the platform. So that is a big differentiator from us, being able to assign a care team directly to the patient to give access. And I'm really going to show you what that looks like. All right. And then just lastly is the caregiver portion. So as I mentioned, family members, outside physicians, you can attach as many caregivers as you like to the platform. You have the same ability that you do with the patient to communicate with the caregiver. So a pretty common use case, we might see a family member living with the patient, needs to go ahead, begin a virtual visit with the caregiver. Me as the clinician, caregiver can be sitting there with the patient. A patient doesn't have a smart device, but maybe they just want to be involved in the plan of care. You can text and email and you have the secure message option. But for another ease of use from your staff's perspective, I can flag this patient to receive the same messages that the patient would. So, let's just say Meredith Daly here is James Cook's daughter. She can receive all those same medication reminders, exercise reminders, whatever is a part of the COPD program, automatically via text or email, whichever she prefers. All right, so let's go ahead and hop over to our Care Connect application, which is our patient-facing application. And then I'd like to show you all some of our reporting and some of the features within the Enterprise Admin tool. This is a patient-facing app. Like I mentioned, you have the ability with the platform just to send a simple text or email if you want a patient to do a video visit or an assessment. They don't need to download an app. You're going to get a little bit more functionality with a patient downloading an application. The application's secure, it's HIPAA compliant, it's encrypted, as well as the video visits outside of the application as well too. But being able to use the remote patient monitoring tools within here, as well as the secure messaging. So as a patient, I'll log into my home screen. Any reminders for me here on my home screen? So if I'm required to take a vital reading, you could see one that just came in about an hour ago that came in around lunchtime, and you can configure these per patient, how often you want to send reminders via text or email. But here's, one message from my COPD program. Okay, so just quick little education message that you saw earlier that automatically comes through. But pretend I'm a COPD patient. I want to go ahead and take my oxygen level reading. In the Connect Devices section, showing you all the ability, you can connect a Bluetooth device or connect directly through Apple Health. Okay, so I already have a Pulse Ox connected here. Pretty quick and easy to pair these devices. The device just needs to be turned on and you pair it directly. Once it's my time to take my oxygen level reading, and I'm just going to go ahead and put the Pulse Ox on my finger and turn on the device, and I'm just going to simply hit, take reading from here, right? And I can get my real-time vitals directly on the screen. oxygen level, and heart rate captured. All right, so as a patient, once I'm done with my reading, all I have to do is hit confirm reading, and then that'll directly populate within the area that you saw within the virtual care application as well as the reporting. Okay, so again, we took the device agnostic approach, see how the industry is going with consumer wearables. We have a lot of clients that come over from different vendors that do supply their own devices and hardware. We've seen a lot of challenges with that over the past couple months, especially with COVID, having to go retrieve those expensive devices, clean those, prep those, and get them ready for the next patient. We've seen the many benefits of patients being able to have their own devices, or agencies going out and even buying these devices as a package at a much lower cost than what many of the other vendors are charging. So as a patient with COPD and CHF, I have a care team assigned to me. So I have the ability directly from here, I can reach out to my individual nurse if I need to via secure message or by virtual visit. Or I could select just the first person that's on call and available. And these care teams are configured by you on the back end, right? So, if I select a button, it's going to call the first available person within that group, and then it's going to route to the next person if that person does not pick up. So think of it like a virtual phone tree. We just call it dynamic call routing. Okay, so if you see it was coming right into Dean Klein, and I'll just go ahead and reject that real quickly. All right, and then our assessment tool, which I mentioned, is equally as powerful as the patient program management. Okay, so this is a way to gather data in between those visits. And like I mentioned, these can be set up recurring, so you don't need to worry about a staff member continuously going in here and assigning this to a patient once a week or daily. But as a patient, I will get a text or email reminder saying I have a new assessment assigned to me. So, within my text, I could just say I have a new assessment waiting for me. Go ahead and click on the link, and it'll bring me directly to the application. So, as a patient, I'll just take this real briefly so you can see what this looks like. So, as I mentioned, I have the ability for a rating scale. I could do yes, no questions. Okay, and I'm going to mention I do have new symptoms here. I do want to create one of those alerts so you can see what that looks like. And I'm going to say, yes, I do want a nurse to come visit me. And I don't have any other feedback. And these assessments can be as long or as short as you need them to be. And I'm going to say, yes, I've had breathing difficulties in the past 48 hours. All right. So now as a patient, I've completed my assessment. So that, again, they could take these assessments via the application on a web page. They don't need the application as well, too. They'll get a text. They click on the link. It'll bring them directly to a web page securely to answer these questions. So now just coming back real briefly before I show you the enterprise admin area is some of the real-time alerts. Okay, so I'm back as Dean Klein, the RN, a part of James Cook's care team. Again, I can run reports, and we're going to show that briefly in a moment here. But as you can see, just 32 seconds ago and 36 seconds ago now, I get some of those real-time alerts. So I'm just logged in on my laptop right now. I'm on the web page, so I'm not going to get an alert pop up right here. But if I was on my phone, if I was on my tablet, I would get a push notification to that device. So I could see here real quickly, James Cook responded he did have breathing difficulties in the past 48 hours. I can send James a secure message, checking in with him, asking him to send me any pictures. Let's just say his temperature is up, or maybe just send a picture of the pulse ox device. If he hasn't connected it to via Bluetooth to the remote patient monitoring section, or if I think it's urgent enough, I can hop on a virtual visit directly with him. Okay, and I just rejected it as James Cook on the other side. So really just to recap before I show you some of the reporting areas, within the patient profile area, as staff members, as clinicians, being able to reduce readmission for some of these major conditions, reduce cost, save time. We've seen clients use a variety of these modalities. I won't even get into the whole wound care side. That's a very common use case of ours. We've seen a lot of our clients that are successful with this save tons of money on dressings, being able to do a virtual visit with a patient or a nurse that's at a patient's home, maybe a wound care specialist, recommend they don't need to change the dressing or recommend another plan of care. That's a pretty common one. But even just on some of the major conditions like CHF, COPD, diabetes, total joint replacement as well too. Being able to push out exercises or reminders for medication via patient program management. And then if you want to gather data on that patient, right? So monitoring them in between visits, you have the assessment tool. And then you also have the ability, just your on-demand methods of communicating with those patients. So all that data is great, but now what do you do with it? Okay, and so that really leads us into our enterprise admin section. This area this can be granted to as many staff members as you need to within your organization. Typically, this is for administrators, directors within organizations, because it really controls the majority of the platform, whether user administration, clinical content, or reporting. There are different levels of administrator permissions that you can give people, so it's not an all or nothing thing. You can give someone permission to just reporting if you need to. But all our reports, just to start off with, everything you can download to CSV. So if you ever need to export any of that data, maybe you need to send it out somewhere, or maybe you need to upload it into your EHR, your system of record, you have the ability to upload, or download all that information directly out of Synzi. So this report is our detailed contact report. It'll give you a summary of all the activity within the platform during a specific date range. And that's everything from video meetings all the way to the messages. And that's with staff and patients and caregivers as well too. So like I mentioned, everything in Synzi is reportable. So if you need to gather any date or timestamps on when a virtual visit took place, how long it took place for, as well as any of the text or emails that come out of the platform. Okay, so as you can see, here's some of the reminders that are going out, what patients they went to, their patient identifier, and if it was sent via email or text message. So on the assessment side, this is again a powerful tool for gathering data. How do you go ahead and manage this data, and what do you do with it? So the ability to get real-time alerts, as you just saw, as a care team member, but maybe as an administrator, as a director, I want to go ahead and view across an entire assessment how each of my patients are responding, a patient population. I can see the response rate, and I can see the number of responses, the percentage of answers people responded to. But then I also have the ability, I can drill down into a specific patient if I need to. And this gives you the ability to either message a patient directly from the report, and I'm going to show you that on the remote patient monitoring aspect. But then you can also download that report if you need to upload it into a specific patient record. So, as you can see, my patient James over here, this was some of the most recent assessments that he took, and here's a recent CHF one. So think of your checks and balances, and this will pour into the same as a remote patient monitoring. I have the ability to message the patient directly from the report. So I can run a report daily or weekly if I want to see specific patient's responses or across a whole assessment. And I could see if someone's responding a certain way. Maybe they want to speak to a nurse, and I could just message them directly from here via text or email or secure message. I can also send it on behalf of a staff member. Okay, so if I need to reach out to that patient, I might be logged in as an administrator. I might not be Dean Klein viewing this report, and I need to send this directly out to the patient. If I know that patient's been reached out to, it's been resolved, I could simply click it off from the report and do that. So let's talk about the remote patient monitoring area, the area where a patient or an agency can configure a Bluetooth enabled device to capture vital signs for a patient. Like I mentioned, you have the ability to create different alarm thresholds. So Again, you want to be alerted every time someone drops below a 94% oxygen level reading. Create that in the platform. Members of those care teams will get that real-time push notification. What that also does, it creates any of those folks in our intervention report. So think of this as your command center. This is really where you're going to be managing your high risk patients. You're going to be managing those patients with CHF and COPD, right? So again, your care team will be getting those immediate responses. You can oversee it as an administrator, a director. Any of the patient's previous readings, I could see their current readings. Again, these you can select a date range. So if you want to run this daily, you can run it in real time as well too. So anytime someone takes a reading that's abnormal will pop up here. And again, you have that same ability that, if I want to reach out to James Cook because I see his oxygen levels dropping, I can message him directly from the report. So we did a lot of time savers within the platform, as you probably saw within the virtual care app, not having to do a lot of clicks, hop around to other areas of the platform to communicate with patients. We wanted to make it easy for those care team members as well as administrators and directors to communicate with patients. All right, and then just lastly, that I thought would be important, not just only in managing chronic conditions, but something that we've seen a large uptick as well in our platform is our mass blast option. So you saw how I was able to individually text and email a patient. You do have the ability, maybe you want to send a bulk reminder to all your patients and all their family members. You could do that, and that'll be via their preference. So it'll be either via text or email. You could simply do that just by a toggle here. I could choose a pre-saved template. Maybe it's a winter storm warning that's coming up. Okay, or maybe it's just a simple coronavirus alert, reminding folks to wash their hands, and if they have any new symptoms, here's the number to call directly. You also do have that ability on the staff side, but like I mentioned, we're not going to be covering much of that area today, and then choose from specific staff groups. So if you just wanted to choose a specific location that a winter storm warning would be affecting, you can do that. But again, you can choose different areas of your patient population. And if you want to send out a blast message to them, maybe it's concerning a specific condition, or maybe it's a general reminder, you have that option. All right, so just before I check to see if there's any questions, just to recap, within Synzi, you have the ability to use a majority of the communication modalities that are out there, not only on the staff side, but the patient side. You have the ability for text, email, secure message, virtual visit, remote patient monitoring via Bluetooth enabled devices, as well as automated programs and assessments. So being able to couple and join all those together, bar none, I think we're one of the best platforms in the marketplace to manage patients with chronic conditions. Patients communicate in all different ways. You might find a specific patient that prefers text and email, while another patient would rather simply just hop on a video call, or they might want to take an assessment in their own time. You need to find a vendor that can provide you with all these different communication modalities in one platform. We see a lot of clients that have a lot of these pieces of technology with multiple vendors, right? And they come to us because they're looking for everything under one umbrella, and being able to manage a patient effectively using all those different modalities. So let me just pause, and I'm going to see if we do have any questions. Okay, so we do have one question, and it says, what did you click to get to the monitoring site? So within the patient profile, as a clinician, as a staff member, every patient's going to have a monitoring section, whether they have Bluetooth enabled devices connected to them or not. That's a setting within the enterprise itself that's configured, and it could be turned on or off. But within the monitoring section here, and it's just a blue banner within the top patient profile, you'll get all their latest updates on their vital readings from here. Okay, and so like I mentioned, now that you saw the interventions and the alerts, I actually, we all know 98% is a suitable oxygen level reading, but I actually had just if they drop below 99%, I want to be alerted just so I can generate this yellow banner so I can show you all that is what a abnormal reading would look like. So as a clinician, if I pull up their monitoring section, I can see when they last took their vital readings. This patient was a little while back, so I can view any abnormal readings. It'll stand out directly to me on the page. All right, so last question. Would love to get a copy of this recording. Absolutely. We will go ahead and publish the recording to this right directly on our website, and I believe we'll be emailing it out directly. So I did just get another question. Does the monitoring section interface with any EMRs? So we are actively, we do have 2 active interfaces that we're working on with a couple vendors. One of the more active interfaces, or excuse me, immediate interfaces is with WellSky. We are pursuing other interfaces with other vendors as well too. A lot of the interfaces will start the majority on the demographic import side, and then we are exploring conversations with other vendors, being able to push whether it's the patient communication messages or the remote patient monitoring data. One of the benefits of being on a newer architecture is that we're pretty flexible. We have an open API platform for any of the technical people out there. We're able to interface with a lot of different folks. So if you do have a specific vendor in mind, please reach out to us directly. If you're a current client, please reach out to your account manager or implementation specialist, and we can absolutely explore that conversation of interfacing that data. Okay, so let me see, I got one other part of the question. Yes. So the monitoring info can be exported out. So any of the remote patient monitoring data can be exported out. It will go to a CSV. The question was if it will go to a PDF. So you can export any of the interventions, the reports as well too. So let me go ahead. I'm just going to pull up, one of the reports in here for remote patient monitoring. So you saw the intervention alerts. Here are the reports directly for a patient, any of their vital readings that were here. So again, you can choose a date range. I will be dropped into a dashboard. Okay, so I can view some real-time data within here by hovering over the different points. And then if I need to export this data out, I could decide to show PHI or hide PHI. Okay, and one other important vendor that, apologies, forgot to mention besides WellSky that we're actively working on integration with is HomeCare Homebase. So those 2 are the most immediate integrations that we do have, and continuing to build on our relationship and interface with those folks as well. So if anyone doesn't have any more questions, appreciate everyone's time. Thank you for watching for the past 48 minutes. Any questions that you do have, please forward along to us. If you're not a client yet, please reach out. More than happy to do a deep dive demo specifically tailored to your organization and a specific use case that you're looking to solve for. Share with you some of the other case studies that we've seen with clients across the country and how our most successful clients are using the platform. And if you are a current client, want to get more involved in the remote patient monitoring area or assessments, like I mentioned, please reach out to your team. Be more than happy to help you. So thank you everyone for your time today. Hope everyone has a great weekend coming up. Thank you.